Hello again, and thank you for joining Module 2 of the SB43 First Responder Training. My name is Dr. Scott Huffman, and I am the Associate Medical Director for the Orange County Healthcare Agency Substance Use Treatment Program. And now I look forward to sharing with you some specific examples, cases, and scenarios that are relevant to our understanding of the expanded definition of grave disability under SB43. A friendly reminder that Module 2 should only be completed after you have reviewed Module 1. Let's get started. I will now review 6 practice scenarios. In this scenario, let us read through it together to determine if criteria for a hold are met, and for all 6 of the scenarios, we will consider warning signs, risk factors, probable cause for danger to self or danger to others or grave disability, and unwillingness or inability to seek voluntary treatment or otherwise engage in a plan for safety. Practice scenario 1. A young man experiences auditory commands to maintain vigil outside a specific church. His fixation on this church resulted in his sleeping on the sidewalk in front of the church at night. Sometimes he is seen sleeping on a grate near parked cars to stay warm. He obtains food through a community program. He has no income and no permanent home. And he has an open, festering wound on his leg, but will not engage in medical treatment as he does not want to leave his vigil and says that God will protect him. He declines reasonable offers of shelter or housing due to his command hallucinations. The conclusion: there is probable cause for grave disability. While this young man is not an imminent threat to himself or others, he is gravely disabled due to lack of shelter and the inability to accept necessary medical care for a condition that could be serious if untreated. And these concerning impacts are likely due to his mental health condition. Let us read through a second scenario to determine if criteria for a hold are met. And again, as we'll do for all of the scenarios, let's consider the warning signs, risk factors, probable cause for danger to self or danger to others or grave disability, and unwillingness or inability to seek voluntary treatment or otherwise engage in a plan for safety. In this scenario, we will see that this individual likely qualifies for a hold under the expanded criteria for SB 43. Practice scenario 2. A 23-year-old woman is found incapacitated on the street with evidence of a drug overdose. She has been taken to the emergency department 3 times in the last 3 months under similar circumstances, each requiring naloxone intervention by paramedics or the hospital. She has no shelter. She also has insulin-dependent diabetes and does not take her insulin, which is causing or placing her at risk of serious complications. She declines medical care due to her substance use and is at risk of having her leg amputated. She is also frequently found in a state of undress, and it is believed that she has been the victim of repeated sexual trauma. Collateral information indicates she frequently seeks out substances. Most of her day is spent around substance-related activities. She is often found intoxicated or withdrawing from substances and neglects her personal safety. The conclusion: there is probable cause for grave disability. Based on her current condition and past history of likely severe substance use, an inability to maintain her personal safety, and the seriousness of her medical condition, she meets criteria for a 5150 for grave disability due to a severe substance use disorder. Let us now read through the third practice scenario to determine if criteria for a hold are met. Practice scenario 3. D is a middle-aged woman with alcohol use disorder who continues to drink despite severe damage of her liver, along with physical symptoms of liver failure, including jaundice. She has numerous prior attempts to stop drinking, including previous substance use treatment programs, but she cannot get below a 0.08 blood alcohol level. Multiple agencies are working to connect her to services as she drinks continuously and is no longer able to demonstrate understanding of her situation or reasoning in her decision-making regarding treatment. The conclusion: there is probable cause for grave disability. Based on her current condition and past history of likely severe substance use disorder, an inability to maintain her personal safety, and the seriousness of her medical condition, she meets criteria for a 5150 for grave disability due to a severe substance use disorder. Let us now read through the fourth practice scenario together to determine if criteria for a hold are met. Practice scenario 4. Jay is a middle-aged man with stimulant use disorder who is severely malnourished, unhoused, and medically compromised with an antibiotic-resistant infection. He repeatedly declines to be assisted with medical care or housing placement in order to keep using methamphetamine. Even when he stops using meth for several days and clears the active drug from his system, he refuses assistance without being able to articulate a plan for managing his infection or nutrition. The conclusion here, there is probable cause for grave disability. Based on his current condition and past history of likely severe substance use, an inability to maintain his personal safety, and the seriousness of his medical condition, he meets criteria for a 5150 for grave disability due to a severe substance use disorder. Let us now read through the fifth practice scenario to determine if criteria for a hold are present. Practice scenario 5. M is a middle-aged person with multiple substance use disorders. On admission to the emergency department 2 days ago, he was intoxicated and unable to describe where he was or how to find shelter and food. Today, he is sobered up from the substances he used, and he says that he would like to be transported to a shelter where he's been living and has been receiving medical care and food. He refuses mental health and substance use treatment services, despite demonstrating understanding about his behaviors when he was admitted and the short and long-term consequences of doing so. The conclusion here, there likely is not probable cause for grave disability. This is based on his current condition at the time of evaluation. He is now sobered up from the substances that he used 2 days ago, and he is now able to demonstrate a plan for his shelter and medical care, regardless of whether he accepts treatment or not. Here is the sixth and final practice scenario. Practice scenario 6. C is an older adult who has been seen in the emergency department multiple times due to wandering into the street while intoxicated. She displays some insight into her inability to stop using drugs and the risks associated with use and is seeking help. While she left from treatment and care twice before against medical advice, she demonstrates a willingness to go to substance use treatment now and to engage in harm reduction services. The conclusion here, there is likely not probable cause for grave disability. This is based on her current condition, the fact that she is willing to accept treatment and harm reduction services voluntarily, even if she previously left treatment unplanned and against medical advice. This concludes Module 2 of the SB 43 First Responder Training. Thank you very much for the service that all of you provide on a daily basis on each of your shifts for our mutual patients and clients. And thank you for taking the time to learn about this new update to involuntary holds. As you can see, SB 43 is not a comprehensive solution to address all aspects of homelessness or substance use. Rather, it is another tool in your toolkit to evaluate an individual for an involuntary hold for what is an expanded yet still focused set of criteria. SB 43 was not meant to address all individuals with substance use disorder. It is instead focused on severe substance use and severe impacts to one's life associated with their substance use, therefore suggesting that one is gravely disabled and they are unable to access services and care on a voluntary basis. Here are our social media links and the QR code and the link to our website for the Orange County Healthcare Agency. And a final note and reminder that if you or a loved one needs help or assistance with mental health or substance use, please consider contacting OC Links at 855-OC-LINKS as listed on the slide, or one may also chat one-on-one with a professional on the OC Navigator website at ocnavigator.org. Both services are staffed by trained behavioral health professionals who can provide information and resources on treatment, and they are also a pathway to the services of the county's mobile crisis response team. Thank you again for joining today.